Hello and welcome to Solutions Ahead. Here we try our level best to bring you solutions for the queries you have asked us about. We have been receiving many emails on discussing about the symptoms, causes and treatment for prostate cancer. Prostate cancer is the most common cancer among men after skin cancer, but the good news is it can often be treated successfully. To find out more about prostate cancer, let me introduce you to my guests here today. Today we have with us Dr. Saurabh Gaur. He's a senior consultant urologist, also the director of UP Stone and Urology Center in Ghaziabad. Also joining us on the show today is Dr. Vikas Agarwal, who's the head of urology and kidney transplant at Asian Hospital, Faridabad. Also joining us today in the show is Dr. Amit Jotwani. Dr. Amit Jotwani is an oncologist and he is also a founder of Onco.com. Well, you know what, before I start the show today, let me quickly tell you, if you have any questions on prostate cancer, you want to know anything about it, you can call us right away on 040-6013-1312 or 13. You can also quickly write an email, send an email to us, and the address here is, the email ID is solutions@indiaaheadnews.com. So welcome to Solutions Ahead. And let me first ask my question here to Dr. Saurabh. Dr. Saurabh, what is prostate cancer? And if you can tell us anything about 3 or 4 early warning signs that the men have to look out for.
To start with, the prostate is an organ in the urinary tract. It is at the junction of bladder and the urethra. So whenever it grows, there are certain abnormal cells which keeps growing and it develops into prostate cancer.
Correct.
Usually, generally, diagnosis is based on symptoms, and many times patient does not have any symptoms. The general symptoms which patient have are burning micturition, hematuria, pain, and all develops at very late in the disease.
Is it? Okay.
Mostly patient will come to us if they have history of any family history of prostate cancer. We do a screening, and generally screening is advised for all the patients above 40 years of age. We do PSA and DRE to diagnose prostate cancer.
Is it? All right. Dr. Vikas, my question to you is that how will the patient know when is the right time for him to probably go and get something diagnosed or to even take a test?
As you rightly said, the prostate cancer is really a second most common cancer in the men. So to take care of everybody as a general health checkup at the age of 45 years, one should get prostate specific antigen, which is a very simple blood test. If we get the marginal or raised level of the serum PSA, then he should be regularly followed with the serum PSA, or he should get examined by a digital rectal examination by a qualified urologist. And if there is no family history, then it should be done at the age of 50, and subsequently at the level when it starts rising, then further tests can confirm the diagnosis of the prostate cancer.
Dr. Amit, my next question is to you. Can you tell me a little about Onco.com, please?
So, Onco.com is a service for cancer patients where we help them get right treatment guidance and find out right doctors for their treatment. And this service was started in the year 2017 when myself and my co-founder Rashi Jain, both of us started this service and as a company, and we are serving cancer patients from across the globe, and the main idea is to help cancer patients get right treatment, because in cancer, right treatment is as important as the treatment itself.
We have our callers here with us, and they are very keen to ask some questions here to Dr. Vikas, Dr. Saurabh and Dr. Amit. Let's find out. Hello and welcome to Solutions Ahead.
Hello ma'am.
Yes.
Myself Gaurav, and I want to know that, is it usually fatal? How long can one live once he has been diagnosed by prostate cancer?
Okay. So is it fatal, and how long can they live then?
Usually prostate cancer is very slow growing, and it's not fatal. Patient usually does not die with prostate cancer, and it is curable. With proper treatment, the lifespan is around 15 to 20 years, we would say.
Right.
And secondly, it also depends when you are diagnosed. So early diagnosis is very important. Now the treatment begins with the staging. If it's early stage, like if there are basically 4 stages of prostate cancer, stage 1, 2, 3 and 4. Stage 1 is clinically when we cannot palpate the tumor. We usually do prostate biopsy, and with PSA we diagnose this kind of prostate cancer. Stage 2 is when it involves a part of the lobe or whole lobe. Stage 3 is when it breaches the capsule of the prostate, and stage 4 is when it involves the adjacent organs or it spreads to all other organs of the body.
Right.
So if you are diagnosed late in the disease, then obviously your lifespan will be shorter. But in general, what we have seen is, as prostate cancer is a disease of old, more than 65 years of age, we usually get prostate cancer. So patient usually lives around 5 to 10 years.
Is it? All right. So I just wanted to know, so let's say somebody right now who's watching the show, who's probably in his 40s or early 50s, should he just go and get a test done in any case, or it's not really required till he sees some symptoms or feels any kind of discomfort particularly?
Like the prostate cancer, there is no specific symptoms for the prostate cancer as such. The only thing is there is a family history that he should be screened at the age of 45 or the 50. Otherwise, if patient develops any low urinary tract symptom like hematuria, means blood in the urine, or there is a difficulty in passing urine, or there is night time he has to wake up, then he should be get diagnosed or be screened or investigated at the center, nearby urology and dedicated surgical center.
And we have a caller here on Solutions Ahead. Hello and welcome to Solutions Ahead.
Hello ma'am, Ravi this side.
Yes, Ravi.
And my question is, in what way does Onco.com help cancer patients?
In what way does Onco.com help cancer patients? Dr. Amit, please answer that for us.
So any cancer patient who needs guidance on treatment or who needs to find right doctor for them can just approach Onco.com website and fill in the forms, and our team, our care manager team, would coordinate with them as to what are their needs, what is their concern, and we can connect them to site specific experts, and they can just begin their case with us. And the panel of experts is designed based on surgical oncologist, medical oncologist, radiation oncologist, and they together discuss the case details, and they formulate a treatment plan for the patient going forward, which helps them get the right treatment. And we also guide them to find right doctors wherever they want to go, because we have expert doctors for different cancers also now. So, but patients don't have source of information, so we guide them to go to right doctors.
Right. We have another caller here, and let's find out who and what the question is. Hello and welcome to Solutions Ahead.
Yes, I am Abhishek from Delhi.
Yes,
my
hi,
question is,
Abhishek.
what are the risk factors involved and the age group of this kind of cancer?
What are the risk factors involved and the age group? I think the age group we've already just discussed about the age group. It's post 65.
Abhishek, it's a very good question. I would like to say, as such, the risk factor for the prostate cancer is the age. But otherwise, if we see, the lifestyle is very important in developing the prostate cancer. If there is fatty patients, obese patients, hypertension, or the patient is taking alcohol, non-vegetarian diet, or the exposure to other chemicals, there is an increased chances that he may develop the prostate cancer. But age is most important, and if there is any family history, so there is a chances increased to develop the prostate cancer in the man.
Right. At this point, I think we'll just take a short break. You're watching Solutions Ahead on India Ahead, and we're talking about symptoms, causes, treatments of prostate cancer. Don't go anywhere. We will be back right here after the short break.